You said this other in the black plague.
Yes, the Yersinia pestis
Right.
bacteria.
Can you give us a little bit more specific on how it's spread and
Sure.
what else about it?
So there was a study done that looked at tooth samples of a number of individuals who had died at that time. And when they looked at the extracts from those and looked at the DNA, what they found was it was very similar to the Yersinia pestis bacteria. This is a bacteria which is in rodents and fleas. So at that time, slums and cities were just growing astronomically, and there were rodents everywhere. And those rodents had fleas, and the fleas, when they bit human beings, spread that bacteria to humans. And then that bacteria would cause a pneumonia, or it could cause buboes or risings of growth, or cause septicemia, sepsis where your blood pressure drops tremendously. All of those would lead to death. And so historical data tells us that it was most likely Yersinia bacteria that was there. Now compare that to Ebola. What we know about Ebola is, yes, it causes tremendous amount of bleeding and then nausea and vomiting, but it's also transmitted in what we're finding out is through bats or what we call bushmeat. And so there's, while yes, both cause a tremendous amount of death, both are infectious, both have an animal vector that causes it, but it tends to be different.
All right, and real quick, I'm just curious, can you give us like a little definition of infectious? Because I don't know if the audience knows out there, infectious disease.
So it's really important to understand how diseases are spread. Some diseases are spread by coughing, like tuberculosis. Some diseases are spread by touching. So, for example, if I have a severe staph infection on my hand, and if I shake hands with someone, I can transmit that staph infection as herpes infection and so forth. Other diseases are spread through sexual transmission, like HIV and AIDS. So what we as doctors of infectious disease do is, yes, we treat patients with infections, but we also look at the transmission of diseases and how to prevent that transmission. With Ebola, we know that that transmission occurs with touching someone or being with someone in close contact when they are highly infectious. And so that's how people are contracting Ebola in Africa, because in that culture they are touching the bodies of people who are dying.
It's really sad what's happening in Africa. Now, if the numbers of Ebola cases were to increase exponentially in Africa, do you foresee the United States closing their borders to those traveling to the afflicted countries?
So, even before talking about when the numbers will increase, let's even talk about right now. There's been a huge push that we should close our borders. When you close the borders, what happens is there's a huge panic. And what will happen in Africa when they're allowed not to have any flights coming into the United States is that those people who do want to fly will then go from the affected countries such as Sierra Leone or Liberia to other parts of Africa. And that then causes more complications, because then you have increased risk of Ebola spreading to other nations, and then they will fly from other nations. And so we cannot close all borders. We have to understand that in ways that we are a interconnected global nation. So closing borders, it will only make it worse. However, if the situation gets so dire that there are a number of new cases coming in the United States, and we cannot control in terms of follow them or control their spread, at that time, for a short period of time, we will, and we may have to close the borders. But we're not in that situation. And when I mean a large number of individuals, right now, just one individual came from Africa who was infected with Ebola.
Right.
And when they're exceedingly large number, then we may need to consider that for a temporary period of time until we get the infection contained.
Now, can't people go from Africa to somewhere else in any other country and just go to America?
Yeah.
That's very possible. So
That's very possible. You see, it's by road. They can go to Uganda, or they can go to any of the other, other countries in Africa.
right.
And then lots of times they may not even show their visa or travel data
Right.
because they want to come for some other purpose to America.
Do you think this could be this is sort of a depressing question, but do you think this could be the worst epidemic in our lifetime? And could it get to that level like the Black Plague, the Red Man?
I think for Africa, it can be a disastrous epidemic. I think one of the worst epidemics that's happened in our lifetimes has been HIV/AIDS. If you just think about this, if at the early stages of HIV/AIDS, we had taken the tremendous amount of precautions that we are with the Ebola epidemic, we could have curtailed that HIV epidemic to not having, millions of people affected today and dying from HIV and AIDS. With Ebola, I think we have learned tremendous lessons from previous diseases, infectious diseases, and including SARS, including avian flu, that we are able to put the resources to contain the infection. Also, the biology of the disease of Ebola is such that it's very time limited, meaning you're only infectious for the period of time that you show symptoms to death. And so that's really, really good that before that you're not infectious. And it's not very easy to transmit the disease at early stages of the illness also. It's only in the late stages. All of that says that in a very developed country where there are good health measures and good infection control, we do not need to fear about the dramatic spread of Ebola like it is in Africa. In Africa, the cultural aspects also play in. There they have different traditions of how they deal with the death of a family member by touching it and doing all of the various rituals.
Right.
And that spreads the disease, and slowly that's changing.
Now, as you know, people in America, whatever comes up on the news, and whatever we hear on the news, we tend to freak out about it.
Yeah,
Yes.
get panic. It's a huge panic. Yeah.
Right. Now, what could we do to minimize that fear factor in America with Ebola, or any disease coming in that could spread?
Absolutely. So we just had a series of conversations about that, both with the political leaders. So Senator Lamar Alexander had put together a roundtable conversation, and all the local politicians were there, hospital leaders were there. And what we had a very clear understanding about was that we have to make sure not to create panic. So once panic occurs, then there is a tremendous amount of disservice that is done that will not allow people to process information. And so what we say is, first, make sure there's no panic. Let information allow people to make the right decisions. And the information is very clear. General population does not need to fear Ebola in America. We know that you will not be getting Ebola when you're going on a plane or on the bus or to the shopping mall. We can do those activities without fear. But we do also understand that travelers can carry Ebola. We do understand that healthcare workers can also contract Ebola. So at the hospital level, we've got to make sure that we ask the right questions. That we ask people, have they traveled to Africa? Have they had met with anyone who may have traveled and had symptoms. And so if we ask some of those questions, we can reduce the risk of healthcare workers and reduce the risk of anyone who comes in and is unidentified and who can potentially spread.
So you feel like people should be, it feels like not a lot of people are very educated about Ebola. Because when they think of Ebola, they feel like, oh my gosh, someone just sneezed across the room, you know, what am I going to do? Do you think they should somewhat educate educate the people a little bit more about this disease?
So the group that can really do it is the media, because
Right.
they have much easier access. And the media and reporters and journalists have a huge responsibility of painting a fair picture of who is at risk and who should be concerned about Ebola. And sometimes the media does that and does a good job. Oftentimes they use it as a way to lure
Right.
the audience into watching and hyping things up. But in balance, I think during this epidemic, the media did a fairly good job of allowing people to weigh in on what was the issue at hand. And then the agencies like the Centers for Disease Control, they have to send out the messages of what's going on at a timely manner.
Right. So one of the questions I asked before a while ago was America isolating itself.
Yeah.
In the book,
Yeah.
Short story, Master Red Death, the rich Prince Prospero, decided to try to isolate him and the wealthy nobles from all the others. Is it a fallacy that the United States can make itself a fortress just like in the Master Red Death? You think
I think it's a fallacy. I think anyone in today's day and age who thinks that they can isolate themselves from the world and other nations, they're having the wrong impression. We look at all the products that we have. Many of them are built in China. You look at people who are traveling at airports. At any given time at Atlanta airport, you will have people from 100 different countries who are just coming in, exchanging flights, and then moving out. And so it's impossible. We would be talking about shutting off the economic trade that occurs between nations. It will really, I can't imagine a world where we would build fortresses. We've come too far. We've got to think of ourselves as living in one global world, one global place. However, within that, we need to know that there will be pockets where there will be diseases, areas where there will be diseases which are common and which can be transmitted, and that we need to work to contain them in the best possible way. So that, for example, we have areas in the world that there is malaria, or we know that there are areas in the world that have tuberculosis. And so we need to work to reduce those diseases in those nations, but then whenever someone comes or someone travels to those areas and comes back, we have to be mindful that they could have those diseases.
Well, people, you heard it from the best, Dr. Jain. I'm Leo Fargenstein. Dr. Jain again, thank you so much for allowing me to come in your house.
Leo,
have an awesome interview. Thank you everyone for watching, and we'll see you next Wednesday.